Good afternoon. This is Joyce Vogler with Vantage Point Consulting, and I'd like to welcome you to the webinar for emergency management, talking about some different issues related to developing a good emergency preparedness program. I do know that we'll probably have a few people joining us, but I wanted to get started so that those of you online don't have to wait. I would like to thank the Indiana Federation for Ambulatory Surgery Centers for sponsoring this through the grant fund, and particularly like to thank Ann Haddock, your emergency management representative, for reaching out to us to work with all the centers in this important topic. Just so that you know that we do have everyone on mute during the webinar. If you have a question or a comment during the webinar, there is a chat feature that you can post a question or comment, and we'll try to, or we will respond to that at the end of the session. I would also like to acknowledge that there's a wide variety of individuals or different types of ambulatory surgery centers on the call. So we've developed this webinar in order to try to reach people at all different levels. If you're new to emergency management, don't get overwhelmed by the information. Use what you can and understand that this is a continuous process of development, and there are a lot of resources available to help you prepare for emergencies and disasters. Those of you that are a little more advanced, hopefully this information will give you some added resources to continue to develop and improve your emergency management program. So today we're going to be talking about the basic principles related to emergency management. We'll review features and functions associated with an incident command system in order to manage an emergency, and we'll discuss some critical areas related to overall to emergency management. When we're talking about emergency management, I just want to make sure that everyone understands definitely what an emergency is. When we're talking about an emergency, it's an unexpected or sudden event that significantly disrupts the organization's ability to provide care, or the environment impaired, or that results in a sudden or significantly changed or increased demand for your services. Emergencies can be natural, or they can be man-made, or they can be a combination of both, and they can exhibit or exist on any continuum of severity. A disaster is a type of an emergency that, due to its complexity, scope, or duration, threatens your organization's capabilities and requires outside assistance. So basically, an emergency is something that you need to handle using some added resources or processes outside of your normal daily operations. And a disaster means that it's overwhelming enough that you can't manage it as a center yourself, and you need to engage outside resources to manage the event. When we're talking about emergency management, there are basically 4 different phases in the emergency management cycle. One of the phases is mitigation, and this is making sure that we have activities or we do things designed to reduce the risk of and the potential damage to due to an impact of an emergency. Some examples of mitigation include construction of a building to make sure it can withstand external damages, such as hardening of our windows, making sure we have generators and good fire suppression systems, or perhaps using sandbags against a flooding situation, or just the fact that we have battery-powered emergency lighting in the centers is also an example of mitigation. When we talk about preparedness, there are a few things that go into this. The most important is making sure that you have a good all-hazards approach to your emergency operations planning process. We do an all-hazards approach, knowing that a lot of the things that we do during an emergency or a disaster situation, it really doesn't matter what the type of reason behind the incident. There's certain things that we're going to do no matter what. And then we add to that, depending on specific types of situations that we determine are high risk for your center, such as you're in a tornado zone area, or you're in a flood zone area, or you're in a high risk area for law enforcement types of issues. So depending on what types of risks that you identify for your center, you would want to have specific plans for those risks. Also want to make sure that when you develop your emergency operations plan that you have copies of that in multiple locations throughout your center, and you have it on different types of media to make sure that everyone has a way to be able to access those copies of your plan in an emergency situation. You also want to make sure that your plan is comprehensive. Make that easy for people to find the information in your plan. During an emergency situation, we don't have time to sit down and thumb through a very large plan. So make sure it's tabbed or indexed so it's easy to find the information that people need at the time of an emergency response. You also want to make sure that all of your staff are trained to the emergency operations plan. It's not adequate for just a couple people to know what the plan is and what the components of your plan are. They may not be there on the day of an emergency, so it's important that everyone has a good basic understanding of how to respond during an emergency and what's in your emergency operations plan. And you also need to periodically drill or test to make sure that the things that you have in your emergency operations plan are going to work in various situations. Another thing that's part of preparedness is to become part of your community or your healthcare coalition. The state of Indiana is divided into 10 different districts for emergency preparedness, and each district has a healthcare coalition. If you have not been invited or a representative of the surgery centers in your general area have not been invited to participate in a healthcare coalition format, please reach out to your hospital that you're closest to or work the most with and to find out who that emergency preparedness coordinator is and ask them if they can get you additional information about your healthcare coalition. The state is really pushing to make sure that all the types of healthcare providers are now being included in these coalitions, including hospitals, the surgery centers, home care agencies, dialysis centers, as well as the health departments, emergency management agencies, and other businesses within your community. So, again, if you've not been part of that, please make sure that you reach out to your hospital to find out how you can participate in your coalition. Another phase of emergency management is the response phase, and this is obviously the most critical of the phases during an emergency situation. And it doesn't matter whether the incident is internal to your center or external. Our priority is always to make sure that we're protecting the lives of those that we're responsible for, including our patients and our staff, and that you protect or preserve your property. It's important that you have good continued situational awareness of what is happening during an emergency so that you can have appropriate warnings and notifications regarding what is going on. It's also important that you plan for what is happening next. To work with your staff and develop a good action plan so that you can be proactive during your response versus reacting to situations. And again, it's also important that during this response phase that you recognize that nobody can do this as a silo. Everybody needs assistance, and there are certainly organizations in your community that are ready and willing to help and assist the ambulatory surgery centers during an emergency situation. The fourth phase of emergency management is recovery, and it's important to understand that recovery starts as soon as the response structure is activated. Also, recovery could take several days, weeks, or even up to years to complete, depending on the amount of damage or service interruption to your center. It's important that you have a process in place to establish your priority services, and during your recovery that you look at what your critical services are and set objectives and strategies to be able to get those services or areas back online first. During recovery, there may be a temporary or interim processes that we have to follow, or we may have to decide that, gosh, based on our rebuilding, we're just going to have to do things differently. You're going to have to make sure that you look at your staff to make sure that they're not overwhelmed. It may be coming into different areas into your facility. There may be a different door that you're going to have people temporarily come into. You maybe have to install some new equipment or new systems that you're going to have to do some training. Another important aspect to follow during recovery is making sure that you manage stress or critical incident stress management for your staff. Depending on the type of an emergency, this can be very traumatic, not only to the victims, but also to our staff that are providing care during this time. And we need to make sure that we take care of our own staff. You also want to acknowledge your staff involvement, express your appreciation and recognition, and support their families as needed. And always after an emergency situation or even an exercise, you want to conduct incident critique and make improvements to your emergency operations plan. When we're responding to an emergency, there are several essential tasks that we want to make sure that we're aware of, and again, kind of following a cycle. This is not a start and end type of thing. It's an ongoing process during an emergency type of situation. One of the first things we want to look at is just making sure that we're aware of the situation. Make sure that someone is really determining what the emergency is and the level of the emergency. Obviously, if it's a local event, you are most likely impacted. It might be you might have a power outage, there might be a fire, or it might be a workplace violence type of a situation. It's happening locally, either at your own center or very near to you in your community. But even a more widespread district type of event or a regional event could affect your operations. It could be flooding in your area, severe weather, an earthquake, or an explosion. Even though you may not be directly involved, it may impact you that you might need to help other people, help other of the healthcare organizations work through this, or it may impact some of your staff that live in the area where the incident occurred. Even a national event like occurred during 9/11 could affect you by affecting air travel or movement of assets to your center. Situational awareness is needed to make a decision whether or not you need to activate your emergency operations plan. You'll want to do continual monitoring of the event, making sure that you get good information from multiple sources, including your own employees, other responders in your community, and monitoring the media and social media as to what is going on in your area. You always want to project forward to determine your course of action. And remember that there could be an overwhelming amount of information coming out during an emergency. Kind of liken it to drinking out of a fire hose. Information is coming fast and furious, and you have to be able to kind of sort out what's important to you. Another task during emergency response is to recognize that sometimes you have to improvise. Yes, we develop an emergency operations plan and that we want to follow, but sometimes the situation could require that you have unplanned or unrehearsed actions based on the novelty of the situation. I kind of liken this to make it feeling like you're learning to fly a plane while you're still building the landing gear is a kind of a good metaphor for needing to understand that you have to improvise. It's also important to be creative and adapt to the situation. Don't focus on what's the same, ask what's different, and recognize that sometimes, again, we have a plan, but we have to adapt to the situation. What worked last time may not necessarily work this time, even though it's a very similar type of a situation. It's important for those that are in the leadership role during an emergency situation to be decisive, but remember too that sometimes it becomes apparent that a wrong decision was made, and we just need to make another one. It's important to just keep moving forward. Obviously, during an emergency situation, we have to take action. One of the things that we sometimes see happens when folks are responding to emergency situations is that they have what we call cognitive bias that influences their actions. If you've had previous experience in emergency management, that's good, but it doesn't necessarily mean that you have all of the answers, and you need to make sure that you do have that good situational awareness and that you listen to others for their input and suggestion for ideas. Again, sometimes you need to be creative, adaptable, and improvise in your plans. An important task in an emergency response is communication. Make sure that your communications are clear and concise, that you communicate clearly, early, and often, and that your communication is transparent. If we don't let people know what's going on, they tend to make it up, and then we have all kinds of rumors and misinformation that we have to counteract. So it's good to remember early, often, clear and concise communication are important. And with any type of process cycle, we need to continually reevaluate how we're doing and keep moving forward. Okay, the next area I'd like to cover is incident command system. As part of your emergency operations plan, you must define or discuss how you're going to from a management standpoint, oversee the incident and respond to it. There have been several presidential directives over the last few years that require all responding agencies and healthcare organizations follow what we call the National Incident Management System. And part of that system, which is a comprehensive system for folks to follow so that everyone is kind of following the same guiding principles, is that during a response to an incident, you establish some type of an incident command system. The State Department of Health has guidance for the healthcare facilities, particularly the hospitals, that they follow what's called Hospital Incident Command System. And this resource through the California Emergency Medical Services Authority has been appointed by the national government as a sponsoring agency to manage the information and tools through HICS. Even though as an ambulatory surgery center, you're not going to follow this exactly, it is a good reference, and the guidebook does have a chapter on how to adapt this to smaller agencies such as the surgery centers. But what we're going to talk about is how you can use incident command system so that you are part of kind of the overall community response, because all of the agencies that respond to emergency situations do follow this basic incident command structure, and it's good for you to kind of understand that process on a global basis, as well as some of the functions and terminology that's going to be used, so that when you're communicating with other agencies, you understand the process. So when we talk about the features of incident command, one of the most important is that you understand that this is a scalable organization. You only activate what you need, and I understand that surgery centers, even though it would be nice to have folks be able to fill a variety of different positions in an incident command structure or system, you just don't have enough staff to do that. So recognize that this is scalable, and you just do what you can with the resources that you have, given a good situational awareness and understanding what's the most critical at the time. Another feature is that you manage the span of control. It's important that you don't try to do more than you're capable of, and that you delegate authority and tasks to others. Integrated communication is really making sure that you have a good communication plan. And this involves several different things, making sure that you understand what triggers your need to share information, what information you need to share with others, who you need to share it with, and what systems you have to share it on. And understanding that you need to have what we call redundant or options in sharing that information in case one mode of communication fails. Another feature is common terminology. When we're talking to other individuals outside of our organization, it's important that we use what we call plain language. We don't want to use codes. I know that some agencies or centers still use like code white or code black, code red. Code red and code blue are probably the two obvious ones used universally, and perhaps those don't need to change. But if we're talking about a tornado warning, call it that when we're activating our emergency plans. Announce to your staff that you're in a tornado warning, or announce and communicate with others that you're interfacing with that you're in a tornado situation versus maybe calling it a color-coded, such as a code black. Another feature of a good incident command system is incident action plan. And again, we want to make sure that you're proactive versus reactive. As you're moving along or moving through your process for responding to an emergency situation, make sure that you're talking among yourselves and that you're developing strategic and tactical objectives with a task to accomplish them. Part of this process is also determining what resources you have and what are needed to accomplish these tasks, and making sure that you assign folks to be responsible for carrying out these tasks. Another feature of Incident Command is to have a location within your center for your Incident Command team to gather. Some of the basic resources that you want to have in your command center include access to a computer and Wi-Fi, either Wi-Fi throughout your center, or if the internet connections are not working due to outages, do you have hotspots or Wi-Fi access? Making sure that this location is on backup power so that if you do have a power outage, you still have power within your command center, that you have communication tools, access to telephones and radios, extra cell phone chargers in case you have to be on your cell phones and those types of things. It's a good idea to have a kit within the command center that you can either open up and use there, or take to other locations within your center that have a different tool that you're going to need. Your plans, the forms that you might want to complete, your checklist or tasks that you might want to accomplish, contact lists for who do you need to contact, not only your own staff, but with outside contacts with other agencies. And just some general supplies. Make sure you have the paper and pens. Maybe have a large Post-it note tablet or whiteboard in the center that you can write notes on to track what's going on. Another feature of Command is resource management. And again, this is working with others within your community, making sure that you understand what resources that are available to you so that if you need assistance, you know who to reach out to for the different resources. The last feature is what we call Unified Command. And again, because in an emergency situation, you're not alone. There are going to be other people that are helping in your response so that you know during this you're likely to be working with law enforcement or fire and making sure that you're coordinating your command process with other agencies. So when we talk about incident command system, this is what the basic structure looks like. There is an incident commander no matter what the type of situation or the level or complexity that we need to respond. And most times for an ambulatory surgery center, that's going to be whoever is your director or person in charge. The command staff also includes looking at safety, liaisoning with other outside agencies, and sharing of information. The second part of the basic command structure is what we call the general staff. And these are those positions that are assigned the responsibilities for carrying out the objectives and tasks that we've established. We have the command structure, and we also have the general staff. And I'm going to kind of review this in a little bit more, just so that you know, within the hospital incident management organizational structure, there are approximately 70 different positions that can be filled. I'm going to skip over this because there's absolutely no way that a surgery center could ever hope to fill all of these positions or need to fill all of these positions. So let's look now at what does the surgery center need to focus on in responding to an emergency situation. Again, looking back at that command staff, the top part of that organizational chart, no matter what the type of an event is, how big or large or small your response to an incident is, you do have to have an incident commander. In all likelihood, that incident commander, depending on the size of your center, is going to fill all of these functions, which include the safety officer, looking at issues regarding incident safety and making sure that all of your staff that are responding to the situation do so safely. Communicating with other agencies that are also active during an emergency response, such as talking to the hospitals, talking to the health department, talking to the emergency management agency or the law enforcement or the fire department. So that's a function that if you have enough folks that you can have a liaison officer, that would be their responsibility. But more likely it's going to fall as a task that the incident commander is going to have to accomplish. Along with information, you want to make sure, again, that you're sharing information not only with your staff and your patients, but also with the public as far as the status of your facility. Depending on the type of incident that we're having, a medical or technical specialist is someone that you might bring into the center regarding a specific incident. So if you were in an area that had a radiological spill for some reason, you might bring in someone that's qualified to advise you on how you would manage your response and recovery due to that type of an incident. So the incident commander, as far as the command staff, you always have to have someone that's identified as an incident commander. The command team, or depending on the size or scope of your facility and response, areas that they're responsible for are making sure that all of your staff are doing and responding safely to an incident, that you have good communication with external agencies that are also responding or assisting with the incident response, that you have good communication with your staff, your patients, and the general public about your ability to respond, and that you have a way to bring in advisors depending on the scope of the incident if you need assistance. So that's the incident command staff. It can be done by the incident commander, or if you're large enough or the scope of the incident is large enough, you can delegate some of those responsibilities to these positions. Okay, the other area, or half of that organizational chart, was what we call the general staff. And these are the folks that carry out the specific tasks that have been established during your strategic or incident action planning process. These include operations, planning, logistics, and finance or administration. And let me go a little bit into more detail about what those functional areas are. Operations are the kind of the mainstay of making sure that we're managing our response to the incident using good resources. And obviously for a healthcare facility, the biggest area of that is medical care. Making sure that you're providing good care to your current patients, plus any patients that may present to your center, whether it's planned, patients coming as referrals from other organizations, or if patients walk in requesting medical care. When we're looking at the medical care that's needed during an emergency situation, it's responsible to are important that you identify what resources you have, what resources you need, particularly pertaining to personnel, supplies, medication, and equipment. So again, one of the biggest areas for healthcare organization to focus on in the operations section is the medical care of your patients. Other areas that may be involved, depending on the type of incident, are what we call staging. This is just if you have a large response, you might have a labor pool set up so that folks are coming in and out as needed, or supplies are distributed as they're needed. The infrastructure, which you're not necessarily going to take care of yourself, you're going to interface with your center's maintenance staff, or if you're leasing space in a larger office complex with that office building's maintenance crew, but making sure that you have the infrastructure to continue services such as power and lighting, water and sewage, heating and cooling, obviously your medical gases, and that your building and grounds are safe to be used, you know, snow removal, ice prevention, those types of things. Also within the operations section, if there's a chemical spill within your center, or if there's something that's happening in the community that is causing a hazardous material situation, this would kind of fall under the responsibility of the operations section. Making sure that you have good intelligence on the chemical or the agent that you're dealing with, how you would clean up a spill, and if anybody needs to be cleaned or decontaminated as a result of this, that you have a process in place to do that. Obviously, we want to have good security in the building, just to make sure that we have some sense of security for the staff. You may need to have a mechanism to locking your facility to prevent entrance if you don't want people coming into your facility during a specific period of time, or that you get assistance from your local law enforcement if there is a security situation or threat to your business. Business continuity means that we're continually looking at our ability to do the behind-the-scenes functions with running your center. Obviously, during an emergency situation, this is something that can be put on hold. But in the scope of the overall incident command structure, this is something that you do want to be cognizant of, so that you can say, you know, this is just going to be put on hold. I'm going to use the people in the billing office for something else during this time, or they can be let go or sent home or resourced to somewhere else. And the last area in operations is what we call family assistance. Again, with your patients, making sure that you're providing assistance to them. If you're aware of shelters that are being set up in the community, or warming stations or food distribution centers that you know, patients contact you, you're able to help connect them with those appropriate resources. So again, in the general staff area, operations is primarily responsible for medical care of any victims. If it's a situation where your center has issues and you need to provide medical care to the patients or added victims coming into your center. These other areas are support functions kind of behind the scenes to make sure that we can continue to provide that medical care to your patients. Okay, also within that general staff area, we have 3 other sections: planning, logistics, and finance. And these are, again, more kind of support things. The planning section, if you remember, I talked about before that when we're responding to an emergency or disaster situation, we have to have good intelligence. We have to have good situational awareness. The planning section helps to gather and collect that information, not only from what's going on perhaps outside of your center, but also inside. So knowing what's going on in the different areas, if you're a large center, what's going on in the different support department areas, support areas, what's going on with your current patients, what's going on with your future patients, and making sure that you're able to make decisions based on that information. They're also kind of monitoring your resources that you have available. So operations is kind of looking at what resources you need as far as staff and supplies. And planning section is helping to kind of monitor the use of those resources and looking forward to kind of say, you know, we're getting close to using all of our resources or exhausting our resources, and how is that going to affect our plan. They're also responsible for making sure we have good documentation during our response. Logistics is responsible for getting the stuff that you need. So when the operations section identifies that you do need additional staff, that you do need additional medical supplies or equipment to continue to manage your response to an incident, someone in logistics is responsible for getting those resources, calling out and getting additional staff, working with your current vendors or other agencies to get medical supplies that you might need if you're running low. And then the last area is what we call finance administration. Their responsibilities are to monitor the costs related to the incident, to make sure that you have a good money management. There may be a situation where you have cash flow issues. Do you have petty cash for emergency purchases? Do you have cash on hand to cover payroll and operational costs if you can't continue to do billing and process invoices and accounts payable and receivable? And then after the incident, they're responsible for obviously paying any invoices and filing any insurance claims as a result of the situation. So again, we were talking about incident command for ambulatory surgery center. We're not looking at this big hospital incident management team chart. Scale it down. This is a scalable operation. You have to have an incident commander. They're responsible for safety, communicating with other agencies, and sharing of information. And then general staff, which is your doers, making sure that you have what you need to provide medical care to your patients or any incoming people seeking care, that you have access or good plans for how you're going to deal with the supporting structures to have that good medical care, that you collect good situational awareness, you have resources to get additional or ways to get additional resources, and that you account for your expenses and can continue to run your business during an emergency situation or following an emergency. Okay, the next area we're going to talk about is critical management functions. And there are 6 areas that we kind of want to look at when we're talking about critical functions. Obviously, communication is one of the key areas. And when some of the most important parts of this are communicating with your staff. What we find a lot of times happens with emergency response is that we do a good job of the staff communication initially, but as the event escalates or goes on for long periods of time, we forget to continue to communicate with our staff. You want to make sure that you let them know what's going on, that you're transparent with your staff. You have frequent huddles, or you do good face-to-face communication to let people know what's going on, and you give out consistent and clear information. Obviously, you want to let your current patients that are in the building and their families know what's going on to keep them calm. You may have to communicate with patients that are scheduled to come in over the next few days to let them know that their scheduling may be interrupted. Another important aspect of communication is that communication with other agencies that are also responding to the emergency, making sure that you share information regarding your status, what your needs are, and how you can assist others if they're in need. You also want to communicate with your vendors. It's a good idea to be, again, proactive. If you have a situation where you're rapidly working through your resources, you want to let them know that as quickly as possible so that they can plan to provide additional resources. And the last area we always talk about when we talk about communication is media. But this really isn't going to affect the surgery centers unless you are the point of disaster. I mean, if the tornado has a direct hit on you, or if you have a situation where you have perhaps a workplace violence issue directly affecting your center, then chances are you're going to have media contact. But if you're part of an overall response to a community situation, chances are media is going to be managed by the hospital, the health department, or the community emergency operations center rather than you directly. So the important things to remember in communication: make sure you talk to your staff, that you let them know what's going on, you have frequent and ongoing communication, and you have a system and are frequently talking to the other agencies about what's going on with you, what your needs are, and how you can help others in need. When we talk about resources and assets, a couple of things to have a process here is a way to quickly know what your inventory on hand is. Again, when we're needing to respond to an emergency situation and needing to continue medical care or to ramp up our medical care, we need to have a way to know what we have on hand very quickly. Where can you get additional resources with your vendors in an emergency situation? And if your vendors aren't available, what are your backup resource options? You might also want to have agreements with other healthcare systems, perhaps with your close nearby hospitals, to share resources in a time of an emergency. Another area that we talk about when we talk about resources and assets are evacuation. Obviously, you want to know your evacuation route, and if you are going to have to move people from your building or your area, where you can stage them until they can be moved safely or transported safely. You also need to know what we call how to close a case. If you have an emergency while you have an active surgery going on, how can you close that safely so that that person can also be evacuated? And I know a lot of the surgery centers are on one level, but occasionally I've been in surgery centers that are maybe not on the first floor of a large office building. So not only do you periodically need to practice horizontal evacuations, but it's a good idea to also practice vertical evacuation. I know that you guys are considered ambulatory surgery or ambulatory centers, but not all your patients are ambulatory. If they're in surgery or post-op, obviously they are not an ambulatory person at that point. And I'm sure that you have patients and or family members that come with those patients that cannot manage long or compromised distances or stairs. So you do need to prepare and practice for how you would manage those types of persons, patients, and or family members during an evacuation process, horizontally or vertically in an emergency situation. When we talk about alternate care sites, you might want to consider if your location is no longer conducive to your continued ability to provide the services that you're authorized for. Can you have a mutual aid agreement with a like organization or a like or another ambulatory surgery center within your community that if you're closed or not able to operate for an extended period of time, that you could use their site during their off hours, either in the evenings or on weekends, to continue to provide services to your patients and schedule during their off times. When we look at safety and security, one of the things is being able to control access, know how you can lock your center down in case there's an outside concern regarding safety, making sure that you have good relationships with your local law enforcement. If you have a situation where they need to come into your center, understand that they will be in charge and you will need to follow their lead. And also that depending on the situation, you may become a crime scene, or areas of your center may become a crime scene, and you will have to work around being closed or having certain areas that are closed within your center. Also, when we talk about safety of your centers, again, if there's a hazmat type of a situation, possibly a spill within your own center, how you're going to manage that. Make sure that you have a way to clean the area, clean off or decontaminate people that may have been exposed to a spilled chemical. Another area to think about in this is waste management. If you have an overflow of biological waste, do you have a good area that you can hold this in until it can be disposed of appropriately? When we're talking about isolation, this can be related to an emerging infectious disease. Make sure you have a good screening process for patients coming into your center. If someone does have a positive screen based on the questions that you're asking, do you have a location that you can isolate them? And do you have the appropriate contact information for the health department or the Indiana State Department of Health as far as notifying that you have someone with a possible infectious disease that you've isolated, and they will then inform you of how to manage that person on an ongoing basis. It's also a good idea to have some personal protective equipment available within your center, so that if you do have a hazmat situation, possible exposure, or infectious disease process, that you do have equipment that you can protect your staff with. And I'll give you a resource for that towards the end of the discussion. Another critical area when we're dealing with emergency management is staff. Make sure that your staff understand their roles and responsibilities in an emergency. Again, it's important that once you develop your emergency operations plan, that you train your staff both at orientation and annually to the major components or key aspects of that plan. You might want to consider also having what I call snippets at monthly staff meetings, where you talk about just different areas of your emergency operations plan. Maybe in March, talk about how you responded to severe weather, tornado-type situations. Maybe in November, you start talking about your response if there's a severe weather emergency. Another month, you talk about how you would respond to a fire. Another month, you talk about evacuation, those types of things. So just spend a few minutes each month talking about different aspects of your plan. And again, we talked earlier about making sure that you manage the stress, making sure that your staff stay healthy. They might need more frequent rest breaks. You might need to bring in some mental health or employee assistance staffing, employee assistance program folks to help manage emotional or mental health responses during emergency traumatic types of experience. Another area is utility management, particularly your susceptible interruptions to electrical outages. You have generators, making sure those generators are tested periodically. How you would deal with refrigerated medications if you have a long-term power outage. Do you have surge protection on major equipment so that when the power does come back on, and there might be spikes when those power comes back on and they don't interrupt or damage any of your equipment. Do any of your pieces of equipment need to be calibrated or recalibrated if they have extended downtime? If you have a water interruption, you may not be impacted greatly unless it is over an extended period of time, or you have to make what we call shelter in place for an extended period of time. Then you want to make sure that you have water resources to keep everybody hydrated. If it's a situation where you don't have the ability to flush toilets, how you can manage waste. For that, one suggestion is to line your toilets with red bags so that you can capture any waste materials that way. During Hurricane Katrina, one of the lessons that was learned is to also put kitty litter in those red bags so that the liquid waste becomes a solid and it's easier to handle during disposal. Know who can turn off, who has the authority to shut down medical gases if you need to evacuate the building. And if you have interruptions in heating, cooling, or ventilation, how does that affect your operations? Would you still be able to stay open? If you have short periods of interruption to heating and cooling, I think one of the biggest components for surgery centers is the ventilation within your operating suites to make sure that you have good controls for humidity for infection control purposes. One of the tools that I sent out prior to the webinar was what we call a basic utility facility response grid, which talks about the different infrastructure components that you need to have to manage a surgery center and what to expect if there is an interruption in any of those areas, and kind of the immediate or the basic response if there is an interruption. And then you would fill out this part, who to contact, whether that be the local power company or the building maintenance folks. You would put in there who to contact. So if you have an electrical power failure, you know, a contact name, a company's name, and a contact number so that it's easy to find this information in one location. So this is just one of the tools that you can incorporate into your emergency operations plan as far as utility response and failures in utilities. Okay, and the last critical area is what we call patient clinical and support activities. There are several different things that are part of this. Obviously, if you are the disaster site, you will have victims, your own patients, and possibly staff that you're going to have to manage. So it is important that you know a basic triage principle. I did send out, again, prior to the webinar, a couple of handouts. One is for triage assessment. If you have, again, victims or injuries, the triage process is to categorize individuals based on the level of care that they need. And the hospitals and the EMS responders have what's called triage tags. There's a couple of different ones out there. This is a picture of one that's occasionally you might see. Again, once you kind of assess an individual and identified their level or category as possibly a red patient or critical, delayed or yellow, minor injuries or first aid level care, or someone that's not survivable, then it's easy for once 911 folks come into your facility for them to be able to manage those patients more quickly. I also gave you a handout that has a couple different triage process on them. This one, if they can walk and talk, they're probably in that first level of category based on their respirations, their capillary refills, their ability to follow commands is another way to look at quickly establishing them into those different triage categories. And the next page is maybe a little more expanded look at that as far as, looking at their respirations, if they're over or under 30 per minute, which categories they go in. So this is just a triage assessment. Hopefully you'll never need it, but again, it is an option to add into your emergency plan in case you do have to triage individuals. It's also a good idea to have some like a disaster kit that has some supplies to manage trauma-type victims, along with ways to either tag them, either some of those triage tags or just some different colors of tape that you could tie around their wrist or ankle so that you can quickly identify categories of patients. Another thing for the surgery centers to think about when we're talking about being part of that healthcare coalition is how, if you're not the disaster site, obviously the hospitals are going to be influxed during a mass casualty type of a situation with lots of victims, and they might need some support to manage that surge of patients. So some different ways that as a surgical center you might help is just an overflow of surgeries. Again, hospitals need to know what types of surgeries you can do on a normal basis and what type of surgeries you are capable of doing on an emergency basis, and they might have individuals that they would refer to you or transfer to you for some of those outpatient type surgeries that might be needed for patients not necessarily needing admission to the hospital. You might also be an adjunct to the hospital. If your center is going to close, if you have a widespread power outage or the environment is just not conducive for you to remain open, you might close for a period of time, and your staff, both nursing and administrative or support staff, could maybe perhaps go to the hospital or a local medical care agent a location that's been set up by Red Cross in the community to help provide care to victims. Another way that you could provide surge support is if you're close or to a hospital or even on a hospital campus, you might be used for what we call a medical staging area. Perhaps they have patients that they're needing to move away from the hospital, such as patients that they identified as being dischargeable but are waiting for someone to come pick them up, you might be a holding area for those discharged patients to come to until their families can come pick them up. Or you might be a triage location for some of the victims that have identified with those lesser type of injuries to come to. You might be a support center. Depending on the type of circumstances, again, may not be conducive to you continuing normal operations, but could we use your center to support the greater good, such as you being an area where hospital staff could come to take rest breaks or to sleep during their off-shift hours? Or could you be opened up as a family gathering place? And another option for that search support might be that you're a treatment center, again, for those patients with just minor injuries. And again, if that's the case, the hospital needs to know what types of patients they could send over to you, what your capabilities are, and what supplies you would need to be able to accomplish that. Another area to think about during clinical support is if you're currently on electronic health records and this system goes down, do you have a good paper documentation backup system in place? And you always want to make sure that you keep those forms current to match your current flow of your electronic records so that they're easy to pick up and use. Realize, too, that if you are on paper documentation, if you've been used to using electronic health records, that you need to enforce good legible handwriting to prevent medical errors, or that you have good checks and balances in place to prevent medical errors due to not good legible handwriting. And the last area is fatality management. I know this is something that surgery centers don't normally deal with, but in an emergency situation, again, if you're the site of the emergency, you may have a death, and do you have a location that you can temporarily hold the body until they can be properly managed by a coroner? Okay, one other resource that I sent out ahead of time that I just want to show here real quickly is the a resource guide. I did go through and put together a few different resources that you can access for just general preparedness. Those smart tags, or again, if you're needing to do triage to identify and assess a victim, this is where those smart tags are available. Just some different options for emergency preparedness, communication. Again, this is the link for the hospital and incident command system, or the incident command, and just some general regulation information. So that's just some information that you might want to look at when you have extra time or developing your plan. So in closing, I do want to thank you for attending today. If you have a need, or we would like to make sure that everyone that was attending the webinar today gets a certificate of training or attendance, what we do need, because I know a lot of folks, you may have multiple people at your location attending or sitting in with you. If you could send us an email with who all was on your webinar today, we will send you a certificate of attendance. You can either send that to me at jfogler or to Jeff at jsfogler, and we'll make sure that you do get a certificate for attending. And then this is just the upcoming webinars, as well as the regional trainings. I know we've gone over a couple minutes, but if there are questions or comments, you can look at that. Okay, so it doesn't appear that there's any questions. Again, we will be sending out or can send out certificates of attendance. Please email us as to who all was on the call with you so that we can send those out. Thank you. We look forward to working with you on additional webinars and regional trainings.